So this is the lumbar traction. We want to start with the upper torso strap and then put the lower torso strap on. Remember, these things are going to wrap around and go to the lateral trunk. This is going to be intermittent traction. We will let the patients know that we use this particular machine for intermittent traction. We use our other machines for static traction. Each has its own purpose, but this is the intermittent traction, meaning it pulls and then it lets go. Okay? So when you lay down on this, basically I'm going to want this to line up with rib cage area. Okay? So you can go ahead and lay down on your back. Good. And then, yeah, just scoot down a little bit more, right about there. Perfect. And we're going to go ahead and strap this in. I'm not going to tighten it up. I'm just going to kind of get it started here. And you know what I'll do is have you just slip your arm right through there. There we go. And I'm going to come around to the other side. Strap the arm, or wrap the arm through there. Now remember, when you go to take a person off of the traction, these things need to be disconnected first. If they try to take their arms out of this before it's disconnected underneath, then they can impinge their shoulders. So we have to make sure these are disconnected, and we'll get to that, but this is just a kind of a preview. So from here, I'm going to have you keep your knees bent for me, please, and then we're going to wrap this right here, and wrap this one right here. Snap it in. You want to get that nice and snug. Sometimes if the belt has not been pre-adjusted just right, you have to kind of move it like this. Generally speaking, you want the buckle towards the middle. And that will slide up a little bit when the traction is first turned on. If we're not using a lot of traction force, it doesn't have to be very snug. So from here, I'm just going to lock this underneath, and then I'm going to connect this to underneath the table here in a crisscross-like fashion. So I'm going to clip that one in there and press this little lever to tighten, to take the slack out of that. It doesn't have to be super tight. And then we're going to do the same thing with this other side. Just make sure your hair is out of the way there. Going underneath. And then we're going to clip on here. And then again, take the slack out. So now these are going to keep her from going down. Make sure that these straps go through this part of the table, not over the top of the table. If you go over the top of the table, this thing can lift up and a person's neck would have to stretch forward. Okay? Now as far as the lumbar belt, we're going to store this thing closed up like this already, okay? And then you basically are just going to open it, and I'll let you know when to lift your hips. But I'm just going to kind of slide that right under there, and then once you lift your hips, I'm going to slide this upwards. There we go. And then relax. Now I'm just going to wrap this around. There may be some initial overlap of the belt, which is okay. They will slide a little bit. You can see this one's just a little bit low, so I'm just going to pull that towards me a little bit. There we go. If these two belts are touching each other, then you didn't start with them far enough apart. Because once they touch, you kind of run out of room to cinch up the straps here. Does that feel okay? Mm-hmm. Okay. We're going to keep these rings out of the way because we'll have the step here underneath the legs. Notice this is adjustable. We're going for a 90-degree angle. We should be pretty close here. So draw your stomach in, tighten it up, bring your knees up. There we go. If they have problems, you're going to have to help them lift their legs up. And then from here, attach the traction. Now the machine is off. Only with the machine off can you release the cord. I'm going to pull the cord release towards the wall, and that elongates this. I'm going to hook onto that D-ring, and I'm going to grab this one, and I'm going to hook on to that one. You notice the bar is in the middle. From here I'm going to take the slack out of the cord by doing that. So now there's just a little bit of tension there. And from here I'm going to turn the machine on and let you know that you'll feel a real gentle pull. We'll be increasing that as it goes. Before you turn the machine on, make sure that the patient has the off switch. You press this, it turns everything off. Press that if you feel something that you don't like.
Okay.
If it feels uncomfortable at all. Okay?
Mm-hmm.
From here I'm going to have you come around to look at this angle. I'm going to press the power button. And then we see the lights come on. And what's going to happen is we're always going to have displayed here the last setting that was on here. I'm going to, you shouldn't have to do this part. I'm just going to preset this. I like the minimum level at 10, the maximum of 15, and that would be, you know, cervical or lumbar as far as that goes. So the first thing is we're going to press treatment time. We'll go 20 minutes. So you just do 20. You don't have to press enter or anything like that. And now it's basically ready to go. I'm going to press start. You're going to hear a little click, and you're going to feel that thing pull on you very gently. That was the click. It doesn't always click, but sometimes it does. So that's a very gentle pull. Okay. Now that's set to go for 30 seconds and then relax for 5. But I'm actually going to progress you a little bit and increase the tension now that you know what to expect. I'm going to press max level. And from here, I press the up arrow. So this up arrow, every time I press this, you're going to see this number get bigger. So it goes to 15 pounds, 16, 17. You have to press it to get it to go up. You can't just keep your finger on it. So I'm going to continue pressing this up. You're going to feel a stretch. If I get anything that approaches uncomfortable, make sure you let me know.
Okay.
The maximum we would want to do would be 75% of their body weight, but we definitely would want to start at that level. Would not want to start at that level. Feeling a pretty good stretch there, and you feel yourself sliding a little bit. How about that? The torso strap, is that comfortable enough there? Yeah. Okay. Okay, so now that I get to 39, it will not let me go higher unless I press lumbar. Because if we were doing somebody's neck, you would not want to go more than 39. So that's just a fail-safe measure to make sure that you have to make a conscious choice to deliver a traction force higher than 40 pounds. And again, if it was something that we were doing with somebody's neck, we definitely wouldn't want to go over 40 pounds. So you have to think to yourself, yeah, I'm doing lumbar spine, so it's okay to do more than 40. In fact, I can theoretically do up to 75% of body weight, but we're not going to start there. Does that feel like a pretty good stretch there?
Yeah, very good.
So we're just going to press start here. This will take just a minute here. And when we press start, then it's going to start counting down, and then it'll give you a rest every 5 seconds. Okay? And then if you wanted to adjust the tension from here, you would just go max level, and then you could actually increase the resistance or decrease it if a person's a little bit uncomfortable. But you always have to hit start after doing that, and then the pounds will appear in the upper left-hand corner. Now, if you need to discontinue the treatment early, the only way to release this tension, unfortunately, is for the patient to press that lever, or for the clinician to press this little button right here that says release. You can barely read that, but it is at least in kind of orange red. You press that, and it will release the tension.
Just below the number 6.
Yeah. So we're assuming now that the full treatment time has been delivered. We're going to continue running video here, and as this releases, we have to remember to do this in the right sequence, and that's going to be, we'll take that from you now that you're not hooked up. Always loosen these before you unsnap them. If you unsnap them, they kind of pop open, and people don't like the way that feels. I'm going to do this one, and the most important thing is to remember for the upper strap, the torso strap, you can just relax there. You definitely need to unsnap it down here first, because there's just not enough range of motion in the shoulders to allow it otherwise. You just slip your hand through there. Do the same thing over here. You slip your hand through. From here we make sure that these things are off and out of the way. You're going to tighten your stomach, bring your knees up towards your chest. Good. And then you can slowly sit up from there. And then to store this, we just need to remember that these things have to be cleaned afterwards, so don't just fold them up and put them somewhere. Make sure they're clean first. After they're clean, you want to always fold it like that, so that when it comes time to use it again, you're going to put it back under there just like we did a few minutes ago. And that's the lumbar traction. We will do the cervical traction next, which is a lot easier.